Today's Coffee with Carrie, I really want to talk about a subject that came up last week when I was speaking on a telehealth panel at a conference. And it was really that physicians and administrators are really thinking about telehealth as like a completely separate business and really getting caught up around the process and the billable codes. And one of the doctors on the panel that I was on said something that really hit me. He said, you have to stop looking at telehealth as a completely separate business. It's the same standard of care. It's just a different channel in which the patient wishes to engage. And he said, if you're not thinking of telehealth as the same standard of care of, working with the patient on how they like to engage, you're going to be losing patients. You're going to be not gaining new patients. And the baby boomers, what they consider convenience and standard of care is changing, and they're expecting, telehealth as well. And so of all the people that, came up to me after this conference and started talking, their brains were really around the concept of looking at hiring new doctors and telehealth as kind of like a separate practice. And it's really not. And you should be thinking about incorporating it into your current doctors, your current processes, your current patients, and looking at it from that standpoint. And it's just a different channel in which patients want to engage. It's the same standard of care. So if I have a sore throat and I'm sitting in front of you and you're going to have me open up, my throat, you're going to look at my tonsils, you're going to ask me a couple questions, you're going to, make me, kind of feel around my nose, see if it's a sinus infection. You can still do that through video and have the patient do that. You can still look in their throat. You can have them give you kind of those senses and so forth. It would be no different. Now, maybe I'm doing some of those things that the doctor would typically do, but it's the same standard of care. So if I have, post surgery, I have a wound and you need to check it. You're still going to, you may not be touching me to check it, but you're still having me show you, you're still having me do the same things that you would do if I was sitting in front of you. Now, it doesn't eliminate in-person visits. So I think things people are really getting caught up on is it's kind of a one stop, or it's to replace appointments. There are going to be circumstances, take a surgery, wound care, that you're going to need to see me in the office. Now, if you have 2 or 3 follow-up appointments scheduled, maybe the first one I'm there in person, and the second 2, if nothing's wrong, rather than me traveling 2 hours round trip for a 5-minute appointment, maybe you can look at me through that as a follow-up consultation. And if there's issues, then I come into the office. So it's not a either or. It's very much in the circumstance and by patient. Some patients will prefer to come into the office. Some patients prefer not to come into the office at all. So it's really up to the doctor or the PA's, really discretion on what the patient preference is, and based on their condition, when it makes sense for them to come in the office and when it's not. So don't look at it as a completely separate practice, or some doctors do it, some doctors don't. Look at it incorporating into your current process, your current patients, your current marketing of new patients, and let the patient choose the channel of choice. And then based on the circumstance, you can either offer or not offer it. That's today's Coffee with Carrie.